lots of principles and rules and regulations, and these are very useful. I think when we're thinking research integrity, having value-based codes of ethics is also really important. And I don't know how many of you are aware of the Global Code of Conduct for Research and Resource Poor Settings. I really like it. I refer to it a lot. And also in the South African and Namibian context, we particularly have the SAN Code of Ethics, which is where we've had a community that has been over-researched and under-respected over many, many generations. And this is in South Africa and Namibia, but I know that in many other places in Africa, I'm sure exactly the same thing. I know exactly the same thing has happened, where researchers, parachute research, where researchers come in, and come in through the window instead of through the front door, as one of the members of the SAN Council actually said to me. And although this is happening less and less, I think having a value-based code helps us to actually reflect, how am I going to act with integrity and with respect and with fairness in this particular research context. So we all know that the Singapore Statement on Research Integrity underpins research integrity, and again, it has what they call them principles, that are also values, and then 14 responsibilities, of which most of them are individual responsibilities, and I think there are only 2 that are focused on institutions. So that's really what I wanted to say as a kind of an introduction and an overview. And then I was asked to reflect on research integrity in Africa. And I do want to give recognition to my colleagues in the African Research Integrity Network, particularly Dr. Christopher van Zyl and Francis Komba, who I know is in the room, who are very much at the moment the leaders in ARIN, trying to get it off the ground, and helped me with these slides. Krista allowed me to use some of the slides from a presentation that she had given recently. So I think there have been articles published that have indicated that there is a problem around research in Africa, and particularly around plagiarism, but that's the one that's showing at the moment. Whether there are other things in terms of this, as the pressure to compete for external research grants and limited resources, that terrible pressure cooker environment continues. We know that other questionable QRPs will also emerge if we go looking for them. So I don't want to dwell on this, but there have been things published in Nature briefs that have highlighted that in one study where they did a random selection of journals, 500 journals from African journals online, and put them all through plagiarism detection software, that according to their definition of what plagiarism was, 63% of articles actually qualified to have plagiarism in those articles. So yeah, I think there are other, it's limited now, but definitely articles starting to emerge from research on research integrity done in Africa. This was a study done by some of my colleagues in South Africa, looking at using the Retraction Watch database and looking at African retractions and what were the reasons, and whether the patterns were any different to European patterns, and also most of the retractions are mainly due to plagiarism or duplicate publication, which in itself is a research integrity issue. You can't, publishing because of perhaps perverse incentives, trying to get as many publications out of one particular data set and publishing the same thing twice but in different journals with different titles and maybe just tweaking things around a bit is in itself a QRP. So that I wanted to just say a little bit about the African Research Integrity Network, or ARIN. The whole idea of this was conceived during the Fourth World Conference of Research Integrity in Rio de Janeiro in Brazil in 2015, which I was lucky enough to be at. And it's from Africa. I mean, absolutely a handful. Well, none of us knew each other, but there was just a real lack of data and initiatives on where, what we were doing in research integrity to promote research integrity in Africa. So this network is still very informal. It's entirely voluntary. It's completely unfunded. It's bringing together individuals from different parts of the continent that have a shared interest in promoting research integrity. And I just think it would be so wonderful if once the COVID pandemic is over, that we could, have, because your countries are showing such leadership in the research integrity space. I was so heartened by what your Minister of Science and Technology said earlier about how important this is, that maybe we would be able to host a conference in Africa that was just focusing on research integrity at some point in Uganda or similar. So, I think it's still very much a fledgling. We're mostly at individual level, not at institution level, and still, I think, partly South African and Kenyan driven, but with representation from other countries as well. So, with a slogan promoting research integrity in Africa and for Africa.
Dr. Horn, your time is almost over.
Has
just 1 minute. You are remaining with just 1 minute. Thank you.
Are that the recognition that it's no good doing research and getting lots of publications out there if they're not trustworthy, and if absolute integrity underpin all of these publications and all of this data that's coming out. And so it's just to continue to actually promote that in the African space. So the last part of my talk was, I hope I'm doing okay.
No, you don't. Your time is over, Dr. Horn.
Research integrity
your time is over, Dr. Horn.
And what are the pillars for this? And I'm just going to go through these quickly. So the first one has been, there's been a lot of talk recently about the need for institutional research integrity promotion plans.
Dr. Horn, could you please
drawing up a plan and a time frame to implement that plan is a very good place for institutions who don't have established offices of research integrity or research integrity, people that are working in dedicated in the research integrity promotion may want to consider. And this is resources available on the net. It is in fact a toolbox with all sorts of resources, and it is part of an EU Horizon 2020 project, so it's ongoing. But if you go onto the web, you'll be able to find and access many of the resources that they've already made available, and then adapt them to your own context. And they have suggested that a research integrity promotion plan needs to at least cover these 9 topics. And needs to explain at an institutional level how you're actually approaching each of them. So the next thing that's really important, the next pillar is policy. Institutions need to have a collection of good policy documents to act as a foundation and a fallback. Even if you don't refer to them all the time, especially when something goes wrong or when there are big questions, then you need to have those policies there. They need to be easily findable and accessible. They mustn't be buried in people's private computers, but they need to be in a policy repository that anybody can actually find. What is the policy on whatever, and they need to be properly implemented, which is much more than just placing policies on a website or sending out an email. So you've got to identify a team responsible for implementation and really assess how the policy is going to impact on other policies, how it's going to impact on processes and things that people are already doing. And then you need to monitor the effectiveness of that implementation. And this is all very, very difficult. And certainly even at my own institution, once you've got probably a lot more to it. So these are just some of the examples that I feel institutions need to have.
Dr. Lynn, you can wind up, please.
Sorry?
Dr. Lynn, you could wind up. Your time is almost over.
Okay. So
it's over,
you need
actually.
a range of policy documents. And then responsible conduct research training is really important. And at UCT, we have now, my office has developed online training, and we are going to be making it available externally quite soon.
You have only 1 minute remaining. Only 1 minute remaining, Dr. Lynn.
Sorry, I thought I had more time. And managing and sharing human research data. So I'm going to how do we foster a research integrity culture? I think top-down and bottom-up leadership is absolutely essential, and then putting enough institutional resources and support, for instance, into establishing an Office of Research Integrity. So integrity and ethics in research, it must be, is it the cherry on the top or part of the mixture? And I think the answer to that question is quite obvious. It has to be part of the mixture. And the thing I wanted to end up with is just to say, please come to the 7th World Conference on Research Integrity. Abstract submission and registration are open. We have got sponsorship for generous travel scholarships for African delegates on condition of an abstract submission and acceptance. And abstract submissions are going to close on the 15th of October. That deadline could be extended, but at the moment it's the 15th of October. So I think that's all from me. Thank you very much.
Okay. Thank you so much. Thank you so much, Dr. Lynn Horn, for that intriguing and informative presentation. I know many of the listeners they have a lot of questions. So we are going to leave it to the plenary session for the question and answer. We go to the third presentation, and I hand over to my co-chair.
Thank you very much, Dr. Stella Nema. We'd like now to introduce our third speaker, who is Dr. Tom Lutalo. Tom Lutalo is Assistant Director of Research at Uganda Virus Research Institute and a senior investigator with the Rakai Health Sciences Program, and he chairs the Uganda Virus Research Institute Research and Ethics Committee. I'll summarize. He has a very long resume, but basically he's an epidemiologist in the field of infectious diseases and reproductive health. He's the current chair of the UVRI REC since 2009, where they review between 8 to 15 new proposals per month. You're most welcome, Dr. Tom Lutalo, to take us through integrity during pandemics, stroke, public health emergencies, reflections on COVID-19 research. You're welcome, Tom.
Thank you very much, Dr. Fred Nakwagala. And presenting after Professor Nelson, who introduced the open system model, and Dr. Lynn, who introduced the pressure cooker research context. It's a great honor coming after those two presentations. So I'll walk you through research integrity during pandemics, reflections on COVID-19 research, whereby I am going to share experiences that us at Uganda Virus Research Institute have gone through. So the outline I'll share why there's a need for research integrity, our UVRI experience, and then the steps to take as researchers. Nelson and Arlene, they've also come up with some very good quotations and publications shared. For me, I would like to share what came from Warren, who has this very, very famous quote that in looking for people to hire, look for three qualities: integrity, intelligence, and energy. And if they don't have the first, the other two will kill you. So during health emergencies, our previous presenters have submitted, we do experience unethical processes and fraud risk factors. They do increase. Why? Because of weakened internal controls. And it is easier during public health emergencies to rationalize somebody's actions. And during public health emergencies, we do find ourselves in the fraud, whereby people take on research because there's an opportunity, there's pressure, and there is rationalization, easy to defend. Why do we have to consider research integrity, the experience with virus? Definitely, there's a need for robust evidence-based conclusions. There's potentially a compromised the ability of researchers to undertake effective compliance monitoring, compromised supervision and oversight, and there's tremendous effect on all examined accounts of scholarly publications. Lynn has also shared those publications, because we find that there is faster mean time to acceptance of papers. This is very apparent. And also, you realize that many peer-reviewed journals, they have now been actually publications on COVID at the expense of non-COVID-19 papers. We've also realized that there's significant reduction in international collaboration for COVID-19 papers. We've realized that there's failure to follow standard guidelines, which will have a detrimental effect on research. Bad practices will distort our knowledge of COVID-19 supervision and oversight, to also obstruct or delay our efforts to stop the pandemic and save lives. We've gone through COVID. This is the COVID experience. However, at the Institute, we've been challenged by not only COVID, but also epidemics like Marburg and Ebola. And because of the compromise, we realize that if at all we don't have set guidelines, it will not stop the pandemic, and it will not save lives. So there's a need for ethical research governance, sometimes which is overtaken by political decisions. And there's an increase in non-scientifically reviewed decisions, sometimes driven by individualism instead of a scientific good. What do we need? We realize that we have to set up two platforms during emergencies. The first platform should clearly set out the competencies around which to pivot the integrity being sought. And the second platform, we need to assess the proficiency with which the researcher is able to apply that integrity. Virus is mandated to be a world-class center of excellence in health research. Whenever there are pandemics, we realize that researchers are propelled to begin the search for diagnostic tests, for treatments, and vaccines in earnest. So researchers tend to call us as REC members, as a chairperson, I've received so many calls. They try to share what they intend to do instead of submitting protocols, as if they are pushed by the powers that be, especially the political arm. At the Institute, we've evaluated about 50 diagnostic kits. However, all these kits, they have inserts. And those inserts read that that particular kit was evaluated in the lab, evaluated by the manufacturer, and sensitivity and specificity is 100%. Remember that at the Institute, all that we do, especially when it comes to what do we find? Well, we receive these inserts, 100% sensitivity and specificity. What do we find when it goes through the evaluation? Only about 2 kits, only 2 actually, have been recommended to the ministry for rapid diagnostic. Only 4 have been recommended to the ministry as diagnostic test for antibodies. Does that mean that the manufacturers did not follow set guidance? Does that mean that when it comes to research integrity by not only researchers, but also manufacturers, is it something that is overlooked? How come that when we evaluate, only about something like 4% reach anywhere near the 100%? 4. Why? So there is substandard research amid the rush to publish, and Dr. Lin and Professor Nelson have alluded to that. Realized that there's an increase in submissions to preprint servers where fewer quality checks are made. This definitely will have implications for patients, clinicians, and potentially the government policy. As of August 2021, when I checked the clinical studies website, there were about 6,454 studies for COVID-19 that had been registered. Other pandemics and epidemics, and I followed, we did not have that high number of registered studies on that website. So during emergencies, this is what we are observing. For UVRI, Uganda Virus Research Institute, we've received over 50 protocols by the Research Ethics Committee Secretariat, but they have to undergo checks, protocol team and content checks. And I have to tell you that many have failed this test. Only 28 have passed the quality check for review. For vaccine trials, these have been undergone joint reviews organized by National Council, but there are so many other protocols, not only to do with vaccine, that have been submitted and have failed quality checks. And all evolve around the integrity of what you want to do. Realize that all active protocols needed amendment because of the risk management plan that needs to be added. However, when it comes to progress reports, we realize that there are many that don't report about loss to follow-up when the outcome of interest requires follow-up periods. Is it that research ethics committees, are you checking this or are you leaving it to pass? So There are so many submissions online. Our procedure is, yes, use the online submission, but also submit hard copies, especially when it comes to review by committee members. We realize that there's been an increase in online submission, but the review process, which is online, is it as good as the hard copy review? Ours, we realize that there's additional requirement, the risk management plan to mitigate mitigation measures when it comes to emergencies. We've also had from the US the operation when it comes to therapeutics and vaccine development. However, we have to sit back and ask ourselves, should we allow the political interference when we've been guided all along with scientific review? You know very well the story of the hydroxychloroquine story. Evidence was insufficient to support treatment of COVID-19. And even there was guidance from NIH, but it was promoted politically. We also have our own story, whereby it comes to emergency use. Some of our treatments, they fall under that for emergency use, but has it undergone the scientific review required? We end up adopting designs of studies because these are driven politically. We end up receiving protocols where there's a suggestion to use placebo-controlled placebo. But is it the right design? Should we use placebo or not? Okay.
Tom, you have 5 minutes.
When it comes to, pardon?
You have 5 minutes.
Yeah. When it comes to joint review, we all have to come together. Face-to-face impact on quality of review is better. It has guided us. Should we use expedited review when it comes to research involving pandemics? There's been modified follow-up and interview conducted on phones. The lockdown has actually compelled amendments to designs. We've realized that there's involvement of pregnant women when it comes to vaccine research with limited safety. I'm going to share these slides. I've already shared them. And for those that we receive, you'll visit these websites, which will update you the need for quality review when it comes to clinical trials. When it comes to publications, shared that information, but comparative analysis revealed that RCTs were disseminated earlier during the COVID pandemic than observational studies. Several papers have been retracted, and this has been shared by Dr. Lin. But remember that average period till publication has only been 33 days. In some cases, retraction of papers occurred within 10 to 48 days. So the huge number of publications short time creates confusion readers during the phases of emergencies. And it is so alarming. Why is there retraction? So abbreviated processes affect patient care and public awareness. It is imperative to follow rapid but rigorous ethical standards for research approval. And there's a need for research conduct and peer review process for diagnostics, therapeutic, and vaccine research during health emergencies. I'll leave you with that slide where FDA has guidance on clinical trial conduct during emergencies, which at least when it comes to discussions in country, we should also borrow a leaf. I thank you.
Yeah. Thank you very much, Tom. We would like now to thank our three speakers, Nelson, Tom, and Lynn, for these very wonderful presentations that I'm sure have sparked emotions, moral emotions, and stamina and energy in all of us, because all of you have been there. There's nobody here who hasn't been affected. You may not have been infected, but you've been affected by this COVID pandemic and its effects. So these were very phenomenal presentations, and I hope that they have opened the can of worms, and now we can try to put the worms back into the can. Now it is the time for questions and answers. And we do have some questions that have come in, and I would like to invite Nelson, Lynn, and Tom to answer these questions. But I have to say that some of them could be answered best by the regulators. So the executive secretaries who are here of relevant bodies, please be ready to answer them. The first question says, networking is key. How has UNCST or Ministry of Science, Technology and Innovation worked to promote networking among researchers? Could the confusion that Tom has mentioned be contributed to by the lack of networking? Or the issues that Lynn mentioned and Nelson, could they have been contributed to by the lack of networking? I think any of the three presenters, you can take a hit on that. And if you can't, like in medical practice, you refer. Nelson, Tom, and Lynn, you've heard the question. Networking is key. How has UNCST or Ministry of Science, Technology and Innovation worked to promote networking among researchers? The question assumes that they have done it. Yes?
Yeah, I'm not local, so I can't really comment on that specifically, but I can say absolutely networking is key. And my experience as a research integrity officer is that so often it is when you have breakdowns in collegiality and communication and skills within a project team, especially a collaborative project team, and particularly a global north, global south project team, and you have breakdowns in those communications, that's when some of these allegations can start arising. So, and increasingly, I think project teams have to actually do some of this responsible conduct of training within their actual teams. And I know international funders are starting to require that. Funders like the NIH now actually want you to put a responsible conduct of research training program as part of your research grant application. So that's partly answering the question, not fully, but in terms of what has been done locally to promote networking, I would have to pass that on to someone else. Thank you.
Okay. Does any of the Ugandan presenters have an idea on how UNCST and MOSTI have worked to promote research regulators?
I think, to be very fair, that's a question for UNCST to answer, to respond to.
I could sense the referral. There it goes. Somebody from UNCST's executive secretary? Yes. So the executive secretary UNCST is going to answer that.
Okay, let me try to take the questions. First, I would like to thank the presenters And then on the question that has been posed on networking, I agree that networking is key. And of course, the annual Research Ethics Conference is one of the networking avenues that we have put in place. And we normally do that every year. And then besides that, we have the Forum for Research Ethics chairpersons, and I think they meet quite regularly. And in these forums, we try to discuss the challenges that are facing researchers, regulators, and those institutional research bureaus. And then also, like in the agriculture area or in biosafety, we have the National Biosafety Committee. And then we also have like the National AIDS Research Committee, and these ones have prominent experts within those committees to guide in that process. But also at institutional level, we also do a lot of networking with the Uganda National Health Research Organization, the National Drug Authority. We also work with the Office of the President, the RDCs, and now we are even trying to have like community guidelines to guide research and the like. So we shall be strengthening our systems right from the grassroots up to the national level. Now, with that aside, in the last 1 year or two, when COVID cropped in, money came in. And you know that in Africa, money sometimes instead of networking, it does the opposite of networking. And then we have had situations where researchers try to jump all the processes and systems in place, and they just want to conduct their research. And sometimes I've received calls that, yes, we shall just go to the highest office. And that's not the best practice. We have to keep sans and handle it quite well to make sure that our research is sound. Thank you.
Thank you very much, particularly for that bold last statement. It takes a bold man to say such things. May God bless you. Now, I would like to suggest, because we are here for business, that UNCST looks seriously into formulating Uganda National Researchers Forum, because it is lacking. And now with the virtual networks we have, it's easy to bring a networking framework for the researchers. Quite many out there are working alone in their own centrifuges, where they are mixing frogs and lizards, and we get a drink out of it. So I think that would be very, very good outcome if it could be put forward. Now we are going to go through the questions very quickly. There are quite many. Clarify how young researchers could tap young researchers, who are the majority of researchers, how could they tap into the Makerere Research Innovation Fund? And I think this should cut across. I don't think it's only Makerere that has the Research Innovation Fund, but if it is the only one, then I think the powers that be have to correct that. We want to hear of a must Musitema wherever, geological institutes, want to hear of research innovation funds everywhere. I hope they are everywhere. But Professor Swankambo, can you take on that?
Yes, sure, Mr. Chairman. The way the Innovation Fund, at least for Makerere, was made, there is a provision for trainees or students to get engaged. However, the award cannot go to a non-Makerere staff. First and foremost, the awardee is a Makerere staff. And so students can team up with a willing faculty so that they can be part and parcel of the research team. But of course, they needed to know which staff is interested in applying for that grant. But the provision is there.
I would like to appreciate your response and inform members that What you've said is not theory, it is actually practice. Our research ethics committees have reviewed quite a number of student proposals under a lead supervisor from Makerere University, and I must confess that the quality of the protocols has been good. I was even wondering whether it was the supervisors writing them. Anyway, just for jokes. But that is already happening, and we thank the powers that be for the opportunities for our students to come on board. To Dr. Lin, how does one become part of the ARIN group that you've talked about? Now, people are in business. They want to become part of these groups.
That sounds super. So what I'm going to do is I will provide the contact details of the steering committee to Winfred, and she can distribute that to the group. And I just wanted to say that I could see in the chat that there was also a typo in my slides, that the World Conference is definitely happening next year. There was a webinar this year, but the actual conference, physical conference, we've just paid the deposit for the venue, so it is going ahead next year at the end of May.
Thank you very much.
It hasn't happened already. Thank you.
And are there plans for the research ethics committees to have softwares like Turnitin?
I don't know whether detecting plagiarism at the point of dissemination of publications and dissemination of research is probably too much of a burden for research ethics committees, and it's something that again comes down to the character and integrity of the researcher, to, even if it's not intentional, to use, to see if they can access, some of there is software for academics to help with this, but just to be very meticulous in writing articles, and citing. And if you feel you're unsure of citation practices, then this is something that researchers, that institutions have to train their researchers on, and particularly their emerging researchers and students that are doing masters and PhDs, that they actually know how to cite and acknowledge accurately, that you can't go onto a website and cut and paste a couple of sentences, and not put quotation marks and think that that's going to be okay, because journals now, all journals run these things through the plagiarism detection software, and they so often pick up. And if they don't pick up, then you land up, having people sometimes it can come back to you in another, even if it isn't intentional. And I think that many cases it's not intentional. It's actually people that perhaps haven't had the training in adequate acknowledgement and citation processes that we need.
Okay, thank you very much. These two questions go to Tom. Shouldn't some of the procedures that have been in place for long be modified for the emergency situation? If countries in Europe and the US have adjusted procedures, shouldn't we be flexible in times of emergencies like public health, as we do our research in Uganda? And secondly, for scientists practicing in the clinical setting, how are they protected from test kits that do not meet the necessary quality checks and are out there on market for use? Sometimes even with marks that show that they have passed the quality assessments by the regulatory authorities. This is Mukama Nayamba stuff, the drink. Apologies.
Yes, we've lived through this experience of amending or coming up with new guidelines during emergencies. I'm happy to say that, Mr. Chair, you were part of the committee task force that was set up, and we came up with guidelines whereby we are guiding researchers on what to do during COVID-19 epidemic. So when it comes to health emergencies, National Council for Science and Technology, we have to agree, it has taken a good lead in ensuring that guidelines are set up, they are drafted, they are discussed, and they are approved. And these are guidelines that are shared amongst researchers. Whoever is listening in, if at all you don't know that such guidelines were drafted, please visit the Uganda National Council for Science and Technology website. We do come up with guidelines depending on the situation. When it comes to kits that are out there being used, the ministry already has teams that actually are out there ensuring that it's only those evaluated and approved kits, recommended kits, that are being used in the laboratories. However,
that's Ministry of Health.
Yeah, Ministry of Health.
Okay.
Ministry of Health has a team. And also, actually, CPHL, this is the Public Health Laboratory, Uganda National Public Health Laboratory. It also has that mandate to ensure that it's only recommended kits that are out there being used. We may find that there are some maybe weaknesses when it comes to ensuring that this is done, but the teams are out there. And by the way, the approved kits, these are also on the Ministry of Health website. So whenever you go out there and you need maybe an antigen test, please, the recommendation by Ministry of Health is on their website. Recommend it to your neighbor, recommend it to your family, but it's out there. It's in the public domain.
Okay, thank you very much. So we are stakeholders in it. Now the easiest question goes to Professor Sewankambu. The realities between politics and research have come to play in Uganda. Please comment and advise universities and RECs how to move in these slippery surfaces.
Sorry, thank you for the question, whoever asked the question. I was for some time, many years in administration, and that was a common issue. Politics at some point trying to derail you from established policy and practice. And the way I always responded and succeeded, and yet I never had any repercussions arising from that, is to stay firm and keep to the process that is supposed to be followed. And if that was to be deviated from, then whoever is asking you should put the request or the recommendation in writing. And at no time did any of the person who was making the request or the recommendation, which had a silver lining with politics, ever made the writing. Vanished, not to return. And I must emphasize, I never had any repercussion from taking that path. I would advise the same to be followed.
Okay, you remember the famous statement by an African president who says, I can guarantee you freedom of speech, but I can't guarantee you freedom after speech. Anyway, politics, we have to learn how to swim in shark-infested waters within the research program. True. I think we're coming to the end. We cannot answer all the questions, but I would like to ask Dr. Lin to answer this. How does the emergency authorization of investigational drugs or vaccines without studying evaluation of the long-term adverse effects of the investigational drugs or vaccines measure against the need to ensure research ethics and integrity? There is a need for emergency use authorization of untested drugs. And how do you balance this with the need to ensuring research integrity? Dr. Lin?
It's a difficult one, and I think it's something that all research, all medicines regulations, authorities have really been battling with. And also in the age of preprints, I think we've seen that people publish their research and preprints, and then the media pick up on the preprints that hasn't been peer reviewed. The actual integrity and maybe the data hasn't gone through, that the analysis hasn't gone through a peer review process. And the next thing it's out in the media that, that ivermectin, for instance, is going to be the cure or the prevention. So it's really difficult. And but I don't think you can compromise on research integrity. I think that we have to find mechanisms of getting these things out there as quickly as possible without compromising on the integrity of the research. Because if we do that, then research becomes untrustworthy. And further down the line, we're going to have, horrible things happening with patients getting adverse events that we haven't reckoned for. So that would be I'm not working in the medicines authority space at the moment. I'm working very much in the research integrity. And currently I'm sitting on a policy research ethics committee rather than a review one. But I just feel that has to be the bottom line, that this research has got to come through as quickly as possible, but without compromising on integrity.
Thank you very much. It may sound theoretical, but these are the kind of questions that my students are answering at the bioethics courses they are doing at Makerere University. And they come out with smiles out of the exam. Now, the last two questions, I'm going to ask the Executive Secretary of UNCST to address them quickly as it comes up. The first one says, does UNCST or any regulatory body have national guidance on how to deal, investigate, and manage investigators, research institutions found not to adhere with research integrity? Or is this left to research institutions? Question number 2 that is related, is there a plan to have a legal backup for the ethical guidelines established? Researchers need to be accountable for misconduct. What is the penalty for misconduct at the moment? And following that, I'll request you to close this session.
Yeah,
and
sure.
we go for lunch.
Okay. Thank you. I will just be brief in my response that at the moment we don't have any regulations or guidelines that we can use for a researcher or done some misconduct. But nevertheless, we are working on that regulation, and we are thinking of coming up with some measures, and that, of course, involves the process of investigation itself, the punishments that may be given, like, for instance, being denied like access to government funding, and a host of other measures. But really, in the last 1 year, we have seen a lot of fraud taking place, and that is something that has prompted us to get into that direction. So probably in a year or so, that system will be in place. So I think with that, I would like to...
Legal backup?
The legal backup at the moment is, of course, the UNCST statute, which was established by the Act of Parliament in 1990, the caption 209, where UNCST is the lead agency in terms of regulation and compliance of researchers in the country. That one is there. But then that document, systems and processes are not yet in place. Thank you.
Thank you. So, thank you. You can.
Yeah. So with that, I would like to thank our 3 presenters this morning. moderating the sessions. Thank you so much. So I will close the session. We can go for lunch and come for the afternoon session. Thank you.
Thank you.
Pardon?